Hello dear friends, how are you today? I hope you are well. Here we are going to talk about another question of cardiology. A 69-year-old hypertensive white British man is currently on indapamide 2.5 mg daily, but his blood pressure is still high. Which of the following is the single best choice to add in order to control his blood pressure? A. Increase dose of diuretic to 5 mg daily. B. Enalapril, which is an ACE inhibitor. C. Atenolol, which is a beta blocker. D. Amlodipine, which is a calcium channel blocker. And E. Prazosin, which is an alpha blocker. Okay, the best choice here is enalapril, which is an ACE inhibitor. Here we are going to explain it. Okay, explanation. You should be able to recognize that the patient is currently on step 1 of the NICE hypertension treatment pathway. Persons aged over 55 or black person or African or Caribbean family origin or any age with hypertension offer antihypertensive treatment with a calcium channel blocker. If a calcium channel blocker is not suitable, for example because of edema or intolerance, or if there is evidence of heart failure or a high risk of heart failure, offer a thiazide-like diuretic. He should therefore be commenced with type 2 by adding an ACE inhibitor or an angiotensin II receptor blocker. An increase in his indapamide, which is a sulfonamide diuretic, dose is not recommended as doses larger than 2.5 mg daily showed non-appreciable antihypertensive effect, but a diuretic effect may become apparent. Okay, the American College of Cardiology and American Heart Association guidelines redefined hypertension classifications. They said normal blood pressure is a systolic blood pressure and a systolic blood pressure of below 120 mm Hg and diastolic blood pressure below 80 mm Hg. An elevated BP of 120 to 129 of systolic blood pressure and below 80 mm Hg or diastolic blood pressure. Diastolic blood pressure is important and categorizing the blood pressure. Okay, stage 1 hypertension, 130 to 139 of systolic blood pressure and 80 to 89 mm Hg of diastolic blood pressure will considered as stage 1 hypertension, and a systolic blood pressure of 140 and diastolic blood pressure of 90 or above is categorized as stage 2 hypertension. Gold standard for BP measurement is the patient must be in seated position and his blood pressure must be checked after a 5-minute rest, and proper cuff size must be chosen, and the bladder encircling must be equal or more than 80% arm circumferences, and confirmatory readings must be more than 2 visits unless the patient has stage 2 hypertension in their first visit. Okay, here was a short explanation about the patient, a 69-year-old antihypertensive patient coming with which is on indapamide to 2.5 mg daily, but his blood pressure is still high. We talked about different types of hypertension, different stages of hypertension management and treatments. You can watch our other YouTube videos for more information. Thank you for your attention.